and welcome everyone to another episode of our virtual interviews. Today, we are very pleased to be joined by Eric Nadalin. Eric serves as the Director of Health Promotion at the Windsor Essex County Health Unit. So, Eric, thank you very much for joining us today. Could you please give us a brief overview of how the policy analysis and evaluation process works over at the Health Unit?
I'll start by saying that policy development is the legislated authority for public health to make policy decisions and implement new public health policy is contained within the Health Protection and Promotion Act. So that's something that the local medical officer of health uses as their legislative guide in order to make policy decisions. And so that's how decisions like the recently issued letter of instruction or a Section 22 order can be made into, law and is then enforceable under that statute. So how does the analysis and evaluation process work? Well, we take into account a number of different public health indicators. Most recently, obviously, those would have to do with COVID-19 and the ongoing pandemic. And policy decisions around that look at, different indicators tied to the spread of the disease caused by the virus, and whether not only our case counts, but also where spread is occurring. Also the severity of disease, also what we could project from other different areas. There's a number of different policy considerations that come into account, and then the different policy levers which are pulled in order to address, we'll say indicators that are moving in the wrong direction are more or less effectuated by the data itself and what our local needs are.
Thank you. What transferable skills from your background as a health promotion specialist come into play when evaluating policies?
There's a number of different policy courses that you can take, and that looks at historically which policy levers have been pulled in response to a number of different public health issues. So policy right now, most topical would be restrictions related to COVID-19. But other things that have been put into place are promotion or advocacy for policy change. And you saw some of that probably around, you're from the University of Windsor. We've worked with your administration at the university on implementing a smoke-free campus policy, and you may have seen some promotion around that going on. So not only does policy stem from an urgent public health crisis, but also from ongoing chronic disease factors that are influenced by things like smoking. So in terms of the training, we use the best available evidence in order to make any decision. In particular, most recently around COVID-19, these aren't decisions that are made lightly or that are made frivolously by the health unit. We use the best available evidence. We have a team of epidemiologists that we work with that study the burden of disease in our community, provide recommendations around how to address that growing burden, and then we would implement measures based on best practices to address those indicators.
So within your field, are there any necessary improvements regarding that policy development? And if so, what are the next steps to kind of carry out these advancements?
I won't speak to any improvements, but what I will say is that one of the challenges in evaluation of public health policy is when you're dealing with interventions at a population health scale, it's oftentimes difficult to attribute a measurable change in a public health indicator to a specific public health intervention. And you might imagine that, if we implement on a broader level a smoke-free campus policy at the University of Windsor, you may not see a measurable impact in health outcomes associated with that policy change for a number of years. Oftentimes it's hard to measure the impact of doing nothing, right? So you make decisions around policy implementation based on the best available evidence, and with a good knowledge that this intervention will, if we do X, then Y will occur, and you implement that policy accordingly, and you track progress over time, and you'll see, things like our smoking rates since the introduction of the Smoke-Free Ontario Act in 2006, our smoking rates have declined dramatically in Ontario.
Well, thank you. Those are all the questions we have for you today, Eric. We really appreciate you taking time out of your busy schedule to come on down and give some insight to us. To our viewers, thank you so much for viewing. If you haven't already, make sure to check out our last episode with Dr. Copty, and we will see you guys in the next one.